Everyone with epilepsy should have a seizure action plan. It's very important for someone who can't communicate for themselves or can't advocate for themselves, but it's really a benefit for everyone with epilepsy. It's a place to keep all that critical information in one place so anybody can have access to it. And more importantly, you feel safe knowing that people will know what to do. If you're a person that might have a tendency to long seizures or cluster seizures or things that happen different from usual, the Seizure Action Plan is a place to record what they normally look like and then what could be a potential emergency for you. And then most importantly, what medications you take daily, but what are these as needed or rescue therapies? And they need to be clearly spelled out as to what they are, how much to give, and when to give. Keeping in mind that if it's not something you take on a daily basis or you need someone else to give it to you, you want to make sure that you have it written down accurately, what to take, when, and how.
It's really important to have a seizure action plan. Our family created one a long time ago when Allison was in school, and it allows all of the people that will interact with Allison the ability to kind of know what to expect and know what to do and when a seizure happens. And they can be kind of robust sometimes. Again, she has multiple seizures and we want to make sure everybody's on the same page. But at the same time, it gives us a little bit of comfort knowing that at least there is some information out there, should we not be right there by her side, that there is somebody there that has an idea of what to do next.
Having a seizure action plan, I have to say, gives me confidence that in the moment that my son may be having a life-altering emergency, people are going to know what to do. And we have found that our school nurse and the administration and all of my son's teachers take this very seriously, and they want to ask questions. Not only do they care about how he's doing, but they want to know when he's having a seizure that they can just observe, and they want to know when he's having a seizure that is going to require intervention on their part.
I like to think about this as a communication tool. It's something that you can create with your healthcare team to put all that critical information in one place, but don't keep it to yourself. Make sure that your healthcare team has a copy. Make sure your primary care provider has one, as well as your neurologist or epilepsy specialist, so they can help you too. But then think about the people close to you. Who do you spend your time with? And make sure that they have a copy and that you have a chance to talk about how they can use it or when they should refer to it.
I think that for a grandparent, for a babysitter, or for a caregiver to hear that they're going to be spending time alone with somebody who has seizures, with somebody who has the possibility of having a life-altering, potentially devastating seizure, it is terrifying. As a parent, it is terrifying. And to be able to hand them a piece of paper, it's a conversation starter. It really enables you to calm them down, to help them understand the frequency that this is happening, the severity with which it's happening, and God forbid if they find themselves in that situation, what to do. We would take that document and we would also share that with any activity providers. So when my son did karate, or he played soccer, or he swam, or he did kayaking or canoeing, the first thing we did with each of those activity providers was give them the seizure action plan, ask them if they had any questions, make sure they understood it. We did the same when he went away to camps during the summer, and as he's getting ready to go away to college, we will do the same as well. He will be responsible for making sure that he has a seizure action plan and that he's sharing it with the people around him that need to be informed about what it includes.
You carry a lot of uncertainty around you with living with epilepsy, and having that action plan can give you that reassurance of, your loved one or your coworker or your teacher or friend is going to know what to do. And so that's one less thing you have to be constantly worrying about.
So your seizure action plan should give an accurate, as detailed as possible description of what your seizure or seizure types are like, what people may anticipate in the event that you have a seizure. What are your current medication? What medications you may or may not have as rescue therapy? When do you administer the rescue therapy? In what setting? Determined by what symptoms you're exhibiting. When should I seek outside emergency treatment. If the rescue therapy is administered and I'm still having seizures, that should be information that is available on your seizure action plan as far as at what point do you determine that you need to go to the emergency room.
So when my son was originally diagnosed with epilepsy, we of course reported it to his school, and we went to the Epilepsy Foundation, and they had a fantastic seizure action plan that we were able to download and personalize it to my son. And the types of things that we included in it were describing the different types of seizures that he had, describing how long we anticipated each of those seizures to last, and then describing the different types of interventions for each of those seizures.
You also want to have information about what is unusual. So if you typically have tonic-clonic seizures and then you're suddenly having like cluster seizures of a different kind, that would be an example of something unusual where 911 would need to maybe be called for you. That's a conversation you should have with your care team, like what is unusual for me, and then have instructions for that situation.
I'm also a mom, and my son had seizures when he was young. And I had to have a seizure action plan for him and keep it regularly updated because I found I traveled a lot for work. And my mother and father would often take care of my son. And so if my husband was at work or I was traveling, they needed to know what to do, and I needed to keep that updated every time I was traveling and on a regular basis because his medications might change, or he grows and his needs change, or his seizure changes.
Yeah, you don't have to wait for your doctor or another professional to create a seizure action plan. I encourage you to take the initiative. You know your seizures best, or your family member's seizures probably better than anyone else. So it's really great that you kick that off, start a seizure action plan, engage other people to make sure it's comprehensive, but ultimately I would say take that initiative, create that seizure action plan, and make it happen.
To find a seizure action plan that will work for you, the Epilepsy Foundation's website at www.epilepsy.com has seizure action plans that you can easily download, and you can have fillable ones that you can complete right there or just print off for your own use. You also can use the Epilepsy Foundation's My Seizure Diary and keep your seizure response form updated electronically and print out whenever you need. Whatever way you choose, make sure that you have a seizure action plan for yourself or for your loved one. And if you need help with finding one of these or even completing a seizure action plan, call the Epilepsy Foundation 1-800-332-1000.